Now we're to talk about some of the interventions that can be used for smoking and nicotine cessation. These are typically beyond the scope of practice for a physical therapist. We are not going to uh, write a prescription for medications. Um, we're probably better off not telling a person to go down and buy over-the-counter medications for this. We're better off referring this out to the doctor, the nurse associated with the doctor, or even to the pharmacist who can give advice on over-the-counter medication. So it's important that we understand these interventions are there, these medicines are there, that using these medicines lead to more effective smoking cessation. But when it gets to the specifics of which to prescribe and how to obtain them, it's best to refer them out to a pharmacist, to a physician, to another medical provider that has those prescription abilities. But we're going to start with medications. And again, medications are shown to really have impact. They help control the cravings and withdrawal symptoms. Using these medications leads to significant improvement in cessation rates and really makes the person's cravings and withdrawals much more tolerable. So there's medications to control symptoms, kind of fast-acting medications that help immediately deliver nicotine. And there's also medications that control and manage the withdrawal symptoms over time. So things like a nicotine patch are used to help with symptoms over time. A gum or a lozenge or an inhaler will deliver this nicotine in a fast fashion to help with the cravings. This is, again, another resource in the Million Hearts website or initiative. They go through, and this is part of your handout, and list all the different medications and whether they're over the counter, when they're used, how long they're used. As physical therapists, I would expect you to be familiar with there's a gum and an inhaler and some of the more common medications and understanding which ones are over the counter, which ones are prescription. But of course, I do not expect you to know the dosage or how long the person should be able to take the medications. I want you to have a sense of the types of medications and how they're used. There are other medications that can be used if the first line medications are not successful. You see some of those listed there, but most people find success with the first line medications. This is a study from 2017 that shows compares different in, uh, interventions for smoking cessation. As you see on the top is that some of the nicotine replacement therapies work much better than the placebo does, and then you'll see that up there. When you start comparing different types of intervention, the gum to the patch, or the inhaler to the patch, or some of the Wellbutrin to the patch, you see the differences aren't there as much. Okay, so which one works best? It's probably an individual preference. The physician or the pharmacist can give some advice on that, but we do know clearly that the nicotine replacement does help improve overall success rates. Is it safe? People say, is this really a safe thing for me to do? Well, the smart aleck response is yes, it's much more safe. It's much more safe than smoking the cigarettes you're already putting in your body. Maybe not the thing you exactly want to say, but educate the person that this is a slow release of nicotine that they're doing, and it's a low dose of nicotine. It's just nicotine. We don't have the same toxins in the medications as you do if you were smoking a cigarette or a pipe or a cigar or anything along that lines. Um, it is treating a medical condition. These nicotine replacements is addressing the withdrawal symptoms, and it's allowing the person to not smoke that brings about other harmful effects. So the quick answer is yes, it is safe. It's non-addictive. Most of the time, people are going to be on these for a few months, and then they're going to be gradually taken off them. Definitely no longer than a year. Usually 6 months, 9 months is how long people are on these medications. There are other non-pharmacological treatments. In your handout, you have more details about some of these, but behavioral therapy, really getting to the point of of why the person's smoking and how they're going to work through cravings and how are they going to work through those situations when their friends wants them to have a cigarette with them. There are self-help programs where you think about what triggers the smoking and you avoid that. You think about how you're going to work through cravings. There's counseling sessions. There's telephone support. There's telehealth where you can talk to somebody over the phone or even over your smartphone about the issues going on through a video chat. So there's a lot of different things that can be done. Um, Remember, motivational interviewing provides a really great way to address this with somebody, and refer to your other lectures on that. Sometimes things like cash prizes, there's been studies done that if you give incentives like vouchers or cash prizes, people are going to be more motivated to attempt to quit smoking. There are some interesting studies out there about forced cessation, where they look at people who've been sent to prison where they're not allowed to smoke, or people who are in a hospital and they're not allowed to smoke in the hospital. What they find is that if cessation programming is offered to the person on discharge or release from either facility, they're more successful at following that or staying off the nicotine. So it can be a platform to start the intervention, but that forced cessation alone is not going to keep somebody from going back to smoking or using nicotine products. It has to be some training or some intervention upon discharge. There are other interventions out there. There are things such as the scare tactic, where they put these really nasty pictures on cigarette packages. They have to put posters around places they sell cigarettes, really just making it in your face what happens because of cigarette smoking. Again, going about some of the text messages, they have smoke-free text messages where you can send a text message to a number and you can say, I'm having a craving, and it'll come back and give you some advice or give you some cueing that way. And of course, it's not a person on their line, but it has been shown to make people slow down and think about what they're doing and recenter themselves before going back to smoking again. Most individuals have to go through the quitting process multiple times before they quit smoking completely. So a relapse is a very, very common thing. And why that happens, they may not have support. They might have been really depressed or in a negative mood. Maybe they didn't have cessation medication, or they weren't on the right medications. Maybe they've gained weight and they feel like I'd rather smoke than do that. And, motivation goes up and down, and how they frame why they're smoking can really determine why whether they'll keep up with their smoking cessation. How do you prevent relapse? You give success on any success, or congratulations on any success. If a person makes it 2 weeks, congratulations. If they make it 2 hours, congratulations. This is a very addictive substance, and we should praise individuals for any period of time they can quit smoking. Try to get the person to reflect on the benefits, and try to get the person to think about how they've worked through some of those struggles. Again, just want to acknowledge weight gain in smoking. That is something that does happen for many individuals. They quit smoking. Smoking is an addiction where you're used to putting things in your mouth, you're used to having things in your hands. If a person is not careful, they can easily gain weight. It should also be said that smoking is a stimulus, so it can speed up someone's metabolism to a certain point. So you take those factors into consideration. You're taking away a stimulus. The person is bored. They feel like they need to put something in their hand, something in their mouth. It leads to overeating and weight gain. Being upfront and honest about that, talking about ways to prevent that, talking about a trade-off between smoking and weight gain, these are all good conversations that have to be had. Sometimes beyond what we talk about as a physical therapist, but hopefully the patient's having that discussion with their provider. Again, this is just an example of a website out there that talks about that idea that every single attempt is a good attempt. Keep trying. You're going to have relapses, but keep it up. I want to talk briefly about e-cigarettes or vaping or juuling. You might say, why is this at the end of the material on interventions? We'll talk a little bit about the history of e-cigarettes and then get into more the reality of today. What an e-cigarette is, it's vaporizing a nicotine solution, allowing the person to get that hit of nicotine without some of the other harmful effects that come along with burning tobacco. Originally, e-cigarettes were put out as a way to help someone quit smoking, as a way to give them the delivery of nicotine that they wanted, give them less tar, give them less toxins. And then the idea was they could slowly decrease the amount of nicotine they have in the cartridges. Well, um, that does work for some, so it may help with smoking cessation. Probably not better than any other things out there from using other cessation medications. More research is finding that e-cigarettes, they don't just have nicotine in them, they have other substances in them which can damage the lungs and hurt the lungs. Juuling is another term you'll hear about this. These are Juul nicotine delivery systems. What this does is, again, it vaporizes the nicotine. It can be delivered to the person. Very popular among children or teenagers. And if you look at it, if you're not looking closely, they look very much like a flash drive or a USB drive. They have little cartridges that can be changed out to give different flavors or different varieties or different strengths of this nicotine. Again, just a different model to look at, or a setup where you see how the Juul or the e-cigarette looks like. Things to point out, more things to point out. There are health risks associated with juuling or e-cigarettes, maybe not as bad as regular cigarettes, but there are. The FDA has decided to regulate e-cigarettes as a tobacco product, even though they don't contain tobacco themselves. So this has helped them regulate a little bit more about some of the health claims or some of the harms that go along with this. What do we know about e-cigarettes? While they have been beneficial for some to help quit smoking and address their nicotine addiction, the number of teenagers using e-cigarettes, and most commonly the Juul brand, is skyrocketing. You'll see in your handout, one study found that across 10,000 high school students and 9,000 middle school students, almost 30% of high school students are juuling or are consistently juuling, and about 11% of middle school students are reporting that they're using e-cigarettes. And many of them are using the flavored kinds. So there's this question of, are these being marketed at children and teenagers with flavors like fruit flavors or candy or desserts? What is going on? What's the motivation behind that? And the studies show that adolescents who use e-cigarettes are more likely to switch over to regular cigarettes eventually. So these e-cigarettes, which were supposedly designed to help reduce cigarette smoking, are actually being used in a different way to lead to teenagers smoking. This is just a nice pathway developed by the College of Cardiology Task Force on consensus documents. It brings together this idea of asking about use, assessing, advise, offer treatment, and follow up. And it really lays out in a pictorial manner what we've talked about, this idea of encouraging people to quit smoking, giving advice, giving treatment, behavioral support, and pharmacological support. This report also really pushes the idea that anytime a person quits smoking, there's benefits with that. We should be assessing people at every single visit. And the best evidence out there is using some sort of pharmacological intervention to help with the symptoms. This report said that e-cigarettes might help reduce smoking in current smokers, but called into question the long-term risks of e-smoking, and we don't really have studies to look at that. So there is a hesitance to, come out and really support that. So how do you bring this all together? I would encourage you to watch some of the resource videos that are in the handout. We're going to practice this in lab. If you have family or friends who smoke, this can be something you can try with them and try to use some of these interventions. Take home point, we have a responsibility to talk to our patients about this and encourage them to quit smoking. This is the video, kind of a cartoon or an animation showing how we can use the A's and the R's in encouraging someone to quit smoking. So you'll see those concepts in the video, a little bit of a humorous take on the whole process, but hopefully it's a video that can show you the implementation of smoking cessation as a physical therapist.